Dengue fever is a tropical disease caused by the dengue virus and transmitted by mosquito. About 4 billion people live in areas with a risk of dengue. The disease is common in many popular tourist destinations in the Caribbean, including Puerto Rico, Central and South America, Southeast Asia, and the Pacific Islands. In the United States, local cases and limited spread of dengue does occur periodically in some states with hot, humid climates and Aedes mosquitoes. About 1 in 4 people infected with dengue will get sick. So, most infected are asymptomatic. But in people who develop symptoms, mostly it's mild and uncomplicated fever is common. The febrile phase involves high fever, potentially over 40 degrees Celsius (104 degrees Fahrenheit), and is associated with generalized pain and a headache. This usually lasts 2 to 7 days. Nausea and vomiting may also occur. A rash occurs in 50 to 80% of those with symptoms. In the first or second day, rash looks like as flushed skin, and later after day 4 it looks like as a measles-like rash. A rash described as islands of white in a sea of red has also been observed. Symptoms can vary from mild to severe, and severe can be life-threatening. Other common symptoms of dengue include nausea, vomiting, rash, aches and pains, eye pain, typically behind the eyes, muscle, joint, or bone pain. About 1 in 20 people who get sick with dengue will develop severe dengue. Severe dengue can result in shock, internal bleeding, and even death. If disease is severe, it can have more severe symptoms, which are called also warning signs. Such symptoms are belly pain, tenderness, vomiting, at least 3 times in 24 hours, bleeding from the nose or gums, vomiting blood, or blood in the stool. Diagnosis. Diagnosis of dengue is typically made clinically, on the basis of reported symptoms and physical examination. This applies especially in endemic areas. However, early disease can be difficult to differentiate from other viral infections. The diagnosis of dengue fever may be confirmed by microbiological laboratory testing. Incubation period for dengue can be from several days up to 14 days. Therefore, travelers returning from endemic areas are unlikely to have dengue fever if symptoms start more than 14 days after arriving home. There is no treatment for dengue. Symptoms control is possible. For mild cases, acetaminophen, also known as paracetamol outside of the United States, to control fever and relieve pain. Do not take aspirin or ibuprofen because of bleeding risks. Drink plenty of fluids to stay hydrated. Drink water or drinks with added electrolytes. Severe dengue is a medical emergency. It requires immediate medical care at a clinic or hospital. In those with severe dengue, care should be provided in an area where there is access to an intensive care unit. Intravenous hydration, if required, is typically only needed for 1 or 2 days. Prevention. Prevention depends on control of and protection from the bites of the mosquito that transmits it. The vaccine is not approved for use in U.S. Travelers who are visiting but not living in an area where dengue is common